Hello everyone and welcome to our module on breast disorders. The evaluation of a woman with a breast mass is incredibly complex and it's not something you're expected to know how to do as a first or second year medical student. But in this module, we're going to talk about a number of breast disorders that often present as a lump in the breast. And in order to understand them better, let me give you a brief overview of how you evaluate a breast mass. Clinical features of the breast mass are very important. Does it change in size with the menstrual cycle? Is there any discharge? And then mammography is often done. This is a special type of imaging of the breast to detect microcalcifications, which are present in many breast tumors. Ultrasound is also used. It can detect fluid-filled cysts, but then ultimately, if you can't be sure whether or not a lesion is benign, biopsy is done. And so under the microscope, you can look at the cells and the tissue and decide whether it's malignant or not. So as we go through these breast disorders, try to focus on these things on the screen here. Try to remember if they have any special clinical features, if they have any special findings by mammography or ultrasound, and then finally, you need to know something about what they will look like on biopsy. So we'll start by talking about fibrocystic changes of the breast. This is a group of breast disorders. It's a group of breast changes or lesions, and these are all benign. They're called non-proliferative breast lesions. They are not associated with an increased risk of breast cancer. These usually occur in premenopausal women, and the women often present to their doctor with a complaint of lumpy, bumpy breast. And the tricky part here is you need to distinguish this from breast cancer. You don't want to ignore a breast cancer and presume it's a benign fibrocystic change of the breast. So I told you that fibrocystic changes are a group of breast disorders, and the reason fibrocystic changes are a group of disorders is because there are a number of different changes in breast tissue that all lead to lumpy, bumpy breasts, and these are all classified as fibrocystic changes. So first, there are simple cysts. These usually occur in the terminal duct lobular unit. They are fluid-filled round cysts, and they're usually filled with dark fluid, so on a gross specimen, they're described as a blue domed cyst, and these can lead to lumpy, bumpy breasts, and simple cysts are classified as a type of fibrocystic change. Second, some women develop fibrosis, so if a cyst ruptures, it can lead to a little bit of inflammation, and that can lead to fibrous tissue, and this can cause lumpy, bumpy breasts, and this is also a fibrocystic change. And then lastly, some women develop apocrine metaplasia. This is also called benign epithelial alteration, and it gets that name because in apocrine metaplasia, there are alterations to the lobular epithelial cells, and they take on the appearance of apocrine or glandular cells, and therefore this is called apocrine metaplasia. And the key thing to know about all of these changes in breast tissue is that they lead to lumpy, bumpy breasts. They're called fibrocystic changes, and they're all benign. So if a woman has a breast lump and a biopsy is done and you find one of the things on this screen that is good news, it's a benign condition. Here are some pictures of fibrocystic changes by ultrasound. Breast cysts just look like black holes here, like you see on the screen. Fibrocystic changes are shown in the slide on the left, so this is a big cyst here. You can see there's lots of fibrous tissue here in this breast, and right here is an example of apocrine metaplasia. Next, we're going to talk about proliferative breast disorders. So in these disorders, there's proliferation of epithelial cells. That's why they're called proliferative. However, the epithelial cells are usually normal. Under the microscope, there's no atypia, and there's no suggestion of cancer cells. What distinguishes these disorders from the benign fibrocystic changes is that these are associated with a small increased risk of breast cancer. So even though the breast lesion itself is benign and not pre-cancer, women who have one of these lesions are at slightly increased risk for developing breast cancer later in their lives. So the key types of proliferative breast disorders we'll talk about in the next few slides are epithelial hyperplasia, sclerosing adenosis, and intraductal papilloma. These can all present as a breast mass, just like fibrocystic changes, but on a biopsy they look different and they have more implications for the woman because they are associated with a higher risk of breast cancer. First, let's talk about epithelial hyperplasia. So normal ducts and lobules have a double layer epithelium with luminal cells and myoepithelial cells. I talk about this in the video on breast tissue. In epithelial hyperplasia, there's an increased number of luminal and myoepithelial cells. You see distended ducts or lobules, and the lumen is usually filled with a cluster of cells. This is an example on the screen here. There's this big clump of cells inside the lumen. That's epithelial hyperplasia. It's a benign condition, however, it's associated with an increased risk of developing breast carcinoma. The definition of the word adenosis is an increased number of acini per breast lobule, and adenosis is normal during pregnancy when the breasts grow. But sometimes adenosis occurs in an abnormal way, and this can lead to what's known as sclerosing adenosis, which is a type of proliferative breast disorder. So in sclerosing adenosis, the breasts develop an increased number of compressed acini surrounded by dense stroma. This is what it looks like under the microscope here. This can lead to a lump in the breast, and there can be concern for breast cancer. Importantly, sclerosing adenosis sometimes results in calcifications, which can be picked up on a mammogram. So a woman can have a breast lump and calcifications on mammogram, and there can be concern that she is developing breast carcinoma. But then the biopsy shows something like what's on the screen here. That is good news because this is not a malignant lesion. However, it is associated with an increased risk of developing breast carcinoma later in life. Finally, an intraductal papilloma is another proliferative breast disorder. It's caused by a growth of ductal epithelial cells. That's why it's called intraductal, because you have proliferation of normal epithelial cells inside a duct. And it usually develops in the ducts or the lactiferous sinuses. So if you look at this drawing on the screen here, these are the major ducts, and these little swellings right underneath the nipple are called the lactiferous sinuses. And this is where these epithelial cells usually grow, and they grow in finger-like projections. That's why it's called a papilloma, because finger-like projections are papilla. This is a picture of what it can look like under the microscope. The bottom line here is that you've got these finger-like growths of tissue. This type of breast lesion often presents with bloody serous discharge, and this is high yield to remember for step 1. In addition, there may be a small mass near the nipple. Remember, the papilloma, the growth of epithelial cells, is occurring in the ducts and the sinuses, which are just below the nipple. Therefore, there's often some blood and some fluid that leaks out of the nipple, and there's also often a mass that you can palpate right below the nipple. Now let's talk about stromal tumors. So most breast cancers are carcinomas, which are tumors that arise from the epithelial cells of the breast. And I talk about breast carcinomas in another video. What I'm going to talk about now are stromal tumors. These are tumors that arise from the intralobular stroma, the connective tissue of the breast. There are two important stromal tumors you should be familiar with. They are the fibroadenoma and the phylloides tumor. We'll talk about both of these in a minute. And they're both caused by stromal growth. Now, sometimes the stromal growth may trigger epithelial proliferation, but these are not tumors of the epithelial cells. They are tumors of the stroma. Let's start with a fibroadenoma, which is the most common benign breast tumor. Fibroadenomas are made up of masses of fibrous and glandular tissue surrounded by compressed epithelial line spaces. This is a picture of what one looks like on the screen here. You can see that there are these bundles of fibrous tissue all smushed together. On ultrasound, fibroadenomas look like the picture shown on the bottom right side of the screen here. Note that there is a well-defined mass that is hypoechoic on ultrasound. Hypoechoic means it is darker than the surrounding tissue, but note that it's not completely black like the cyst that we saw earlier. Fibroadenomas have a dark gray color to them, and that's what distinguishes them from breast cysts. Fibroadenomas occur in women 15 to 35 years of age, so usually pre-menopausal women. These tumors are hormone sensitive, so they tend to increase in size during the menstrual cycle and also during pregnancy, and they decrease in size after menopause when hormone levels fall. They are identified on physical exam, usually by a woman, as a well-defined solid mobile mass. Obviously, there is usually concern for a malignant carcinoma of the breast, but luckily, as I told you before, these are benign tumors, and they develop in the lobules of the breast, and that's what leads to the growth of the stromal tissue that leads to these tumors. The second type of stromal tumor is called a phylloides tumor. This is also a stromal fibroepithelial tumor like a fibroadenoma. It's usually benign. The low-grade forms of phylloides tumors are similar to fibroadenomas. However, there are rare high-grade variants that can metastasize, so this is not always benign like a fibroadenoma. These usually present in older women over 60 years of age, and the word phylloides is the Greek word for leaf-like, and it gets that name because in this type of tumor there are leaf-like growths of stroma covered by epithelial cells. Under the microscope, these look like the picture on the right side of the screen here. It's stromal tissue growing in a pattern that looks like the leaf of a tree. On ultrasound, what you see is a mixture of gray and black areas, and that's because of the leaf-like growth of these tumors. So if you look closely at this ultrasound image on the left side of the screen, you can see some areas that are gray like the fibroadenoma, but other areas that are dark like the breast cyst, and that's because this isn't a completely solid mass like a fibroadenoma. It has spaces between the tumor, and those spaces are the black parts you see on ultrasound. I'm going to finish this module by talking about 3 inflammatory conditions that can sometimes be mistaken for malignancy in the breast, but they're all caused by inflammation. The first one is called mammary duct ectasia. This is a benign inflammatory condition of the breast. It usually affects older women about 50 years of age, and it classically affects multiparous women, so women who've had a number of children. In mammary duct ectasia, there is distension or ectasia of the subareolar ducts, which are right below the nipple. This is caused by chronic inflammation and fibrosis of those ducts below the nipple, so it presents as a mass usually right below the nipple with thick white discharge, and the thick white discharge is caused by the inflammatory tissue. There's usually no pain or erythema, but the concern here is that it may represent breast cancer. So in a board question, this is likely going to be an older woman who has a number of children who presents with a breast mass right below the nipple that has thick white discharge. This is likely a description of mammary duct ectasia. And under the microscope, it looks like this. So this is a duct, but you can see it's misshapen. That's what ectasia means. It's distension of the duct. And then you can see that there are inflammatory cells outside the duct. That's evidence of inflammation. So you've got a misshapen ectatic duct with inflammatory cells. That's mammary duct ectasia. Next, let's talk about fat necrosis. Fat necrosis of the breast results from trauma. Often it's a prior breast biopsy or breast surgery, although it can sometimes be a sports injury or a seatbelt injury. And many women, in fact, do not recall a specific trauma prior to developing fat necrosis. It's a benign inflammatory process just like mammary duct ectasia, and also like mammary duct ectasia, it often mimics breast cancer. It can present as a painless mass in the breast. It's often asymptomatic, and it can sometimes lead to calcifications on mammogram. And remember, this often follows a breast biopsy or breast surgery, so this may be a woman who's already had a breast cancer and is very worried about recurrence and now develops a new mass. She'll obviously be very frightened, but the good news is that fat necrosis is not a malignant condition. When a biopsy is performed, what you see is fat cells with evidence of inflammatory cells surrounding it, like what's shown in this picture at the top of the screen here. Next, let's talk about mastitis, which is inflammation of the breast tissue. There are two subtypes of mastitis you should be familiar with. The first type is called lactational or acute mastitis, and the reason it's called lactational is because it occurs in women during breastfeeding. When women are breastfeeding and their baby is on the breast multiple times per day, this can lead to trauma to the skin around the nipple. This can then lead to erythema and tenderness of the breast and even sometimes fever and malaise. Most commonly, this is caused by infection with Staph aureus, which, as you know, is a skin flora, and an easy way to think of this condition is that it's just like cellulitis of the breast. The usual treatments are the antibiotics dicoxicillin or cephalexin, both of which have activity against Staph aureus. And then two important things to know about this. One is that the mother should continue nursing. If mothers stop nursing because of mastitis, their breast tissue will involute and they won't be able to nurse the baby any longer, and there's no danger to nursing a baby in the setting of mastitis. And the second thing to be aware of is that these mastitis infections sometimes progress to an abscess, and this sometimes requires surgical drainage. The other type of mastitis is called periductal mastitis. It's also called squamous metaplasia of the lactiferous ducts. I'll explain why it gets these names in a minute. In this condition, there's inflammation of the subareolar ducts, so it's the ducts of the breast right below the areola and the nipple. And more than 90% of cases of this condition occur in female smokers. It's thought that smoking is toxic to the subareolar ducts. There's also some data showing that smoking may cause a relative vitamin A deficiency in the ducts, and that can lead to damage. So I put a picture of a female smoker on the screen here to remind you that this condition in a board question is usually going to be a woman who smokes. What happens in periductal mastitis is that inflammation leads to squamous metaplasia such that the duct epithelium, which is usually cuboidal, becomes squamous. Normally, when you have a duct that drains to the nipple in the breast, that duct is lined by cuboidal epithelium, like I'm showing here in my drawing. What happens in periductal mastitis is that the cuboidal epithelium undergoes metaplasia and becomes squamous cells that grow into the lumen and obstruct the duct. This leads to a backup of secretions and fluid behind the obstruction, and that leads to inflammation and mastitis. So what you've got happening here is damage to the duct leading to cuboidal cells undergoing squamous metaplasia, and that leading to obstruction of the duct. So if you understand that, then it's very easy to understand that this will present as a periareolar mass with redness, tenderness, and warmth from all the inflammation. Often there is a secondary infection that requires antibiotics, and it's often treated with incision and drainage to get out that fluid that is backed up behind the obstruction. I'll finish this video with two summary slides to help you keep all these breast disorders straight. So remember that we talked about fibrocystic changes, which include all these types of breast changes shown here, and these are all benign conditions of the breast. We then talked about proliferative breast disorders. They include all of these items I've listed on the slide here. These are also benign conditions, meaning they do not metastasize. However, they are associated with an increased risk of developing breast carcinoma, but these lesions themselves are usually benign and are not precursors to cancer. And then finally, we talked about stromal tumors, which are tumors that arise from the stromal tissue in the lobules. These include fibroadenoma, which is benign, and phylloides tumor, which is also usually benign, but in a small percentage of cases can become metastatic. And then these three conditions shown on this slide are all inflammatory, and they all have specific clinical features that usually make them easy to identify. So in mammary duct ectasia, there's white discharge from the nipple, Fat necrosis usually follows trauma, often a woman who has had a breast biopsy or breast surgery, and mastitis presents with erythema and tenderness of the breast. And that concludes our video on breast disorders.